Back to Good Things Utah, just talking with Alfie and Beth. They are the nurses at Utah Facial Plastics. Usually you see Dr. T here, but these are like the girls that make it all happen at his office.
Well, thank you.
Good to see you guys.
Good to see you.
We're talking Botox today. If you've been looking in the mirror, if you've gone makeup free and thought, wait a second, where did that line come from? Where did this line? How do you know if you need Botox, girls?
Sometimes you don't, at least not yet. So the best thing to do is come in and get a consultation, and we can discuss things, because you might not need it. You might be too young, you might have wrinkles where you don't put Botox, and there are several things we can do to treat that. Microneedling, chemical peels, skin care, and that can all be discussed at your initial consultation in our office.
Beth, you're new to the team. If I came in and saw you, would you tell me if I didn't need it?
Absolutely. Yeah, we would go over your basic needs and what you're desiring to have done, and we can always find something to do for you, whether it's simple skincare or, like Alfie said, doing like a chemical peel or something other than Botox. We're more than willing to go over
or
that.
all of it if you need it.
Or we'll tell you.
Like,
yeah,
I need
right.
I like to say, in this, we've talked about makeup a lot today, but it's your relationship with the mirror, right?
It's what you want.
What you see, what you're frustrated with, or maybe you'd like to soften just a little bit. Is there
Absolutely.
an age? Is there a specific age you need to start Botox?
There really is no specific age that we recommend you start. Most of our patients come in when they begin to see the little etched lines in their skin, also known as the static lines, and those are lines that are there when you're not making an expression. They've formed over time, and so that's the majority of the patients that we see. Common areas that we treat for those little etched lines are around the eyes and kind of the crow's feet area, between the eyes and the frown lines, as well as the forehead area.
All right, so if I get a little Botox every once in a while and I'll have sometimes a bruise, how do you decrease that if you don't want to have a little bruising?
Okay, so bruising with Botox isn't very common, but it is always a risk.
Sometimes it's a tiny little thing.
Happen. Yeah.
But it goes away.
It does, yeah. So avoiding aspirin, ibuprofen, fish oil, vitamin E a week prior to your treatment will help. And then we also treat with those cute little ice packs before and after.
They are really cute, the little cute pink ones.
And that helps.
That does help.
All right, what about imitation Botox? Are there fakes out there, and how do you know?
Unfortunately, there are. That's why it's so important that you do your research before you choose an injector. Make sure they have the certification and training behind them so that they know what they're doing. It's just a way that sometimes companies choose to cut costs, and it can be less effective and just not give you the results that you're desiring. So really make sure you choose an injector that orders their Botox directly from the manufacturer.
It's also not just for wrinkles, right? Botox?
Right. It's not just for wrinkles. We use it to create a non-surgical brow lift if injected in the right spot. And then we also use it for the bands around the neck that are showing. We can slim the lower face with Botox by injecting it into the jaw muscles.
Ooh,
yeah.
Face shaping.
Yes,
All right,
face shaping.
and less is more. What I love about these ladies and Utah Facial Plastics is they are not going to overdo.
Right.
They're not going to let
Right.
you have this frozen face look that everyone laughs at when they say the word Botox.
Right.
That's right.
That's what the Dr. Thompson, I love talking to him about it, because he really won't do something crazy on you. If you, I mean, he's not your doctor if you want to look like the Joker, because he is. He's very soft.
He's not going to let
right.
it happen.
Right.
Okay, so if they're at home right now watching, go to the mirror, and is it what did you call it? Your resting face?
It's kind of those, resting
static
face, and you
lines.
see these little static lines or little
Static
etched lines in your skin that have formed over time.
Yeah.
And you see them now without expression.
So my mom likes to say, I just look mad if I don't have that little bit of lift. But it's true. If your resting face looks like it's down, is that Botox or something else that you use to kind of do this?
It's both.
It's both.
We use Botox and filler for that around the mouth.
But it changes the way you
It
look,
does.
and you can look, if you look unhappy or mad, you
Yeah.
can change that.
Well, and you
It
can
does,
dip
yeah.
your toe in the water, right? You
Yes,
could just try a little bit
absolutely.
and see what you think, and these girls are so great. You can go back in and get a little bit more.
Yeah,
too.
it's easier to add than it is. You can't take it away. So, it's better to start out soft and move your way up.
Utah Facial Plastics has deals in July, everybody. It's almost July. Can you believe it? All
No.
of these specials right there on your screen. Go to our website. We'll link you to theirs. It's utahfacialplastics.com. Oh,
Look, and there's Nisha.
yep.
Oh,
I love it.
And I
Pretty girl.
love your office.
I do
there
too.
I am,
we
right
love
there.
you too.
Everybody in
you,
there's
girl.
So good
wonderful.
to see you too. Thanks for having us.
you.
Well, after you get a little Botox, maybe you make a deep dish cookie. Chef Leslie is going to show us how next.
Oh yeah, and she's really getting into it too.